We are at the Rio de Janeiro Liver Week. I'm Cristiane Vilela Nogueira. I'm a professor at the Federal University of Rio de Janeiro. And it's an honor to have as our guest Professor Zobair Younossi. And we are so happy to have him here. And soon we will have the World Liver Day on April 19th. So we would like to ask you some questions.
Of course.
And the first one will be about your expectations in the next year regarding obesity epidemic and MASLD.
Yeah. Well, first of all, let me take a moment to thank you, the organizers of this fantastic meeting, and of course, in this beautiful city of Rio de Janeiro and the beautiful country of Brazil. I'm Zobair Younossi. I'm of the chairman of the Global NASH Council, and also I'm the chair of the Global Center for Outcomes and Policy Research in Liver Disease at Georgetown University in Washington, D.C. I've been involved in the field of MASLD for 30 years or so, and I have to tell you that that MASLD is becoming the most common liver disease worldwide, and it's driven by the pandemic of both obesity and type 2 diabetes worldwide. So, as we are celebrating or acknowledging our Liver Day in the next few weeks, it's important to recognize and remember that MASLD is the most important non-communicable liver disease. It is currently the number 2 indication for liver transplantation, both in Europe and the United States, as well as in Brazil. It is one of the most common cause of cirrhosis and liver cancer worldwide. And unfortunately, the prediction is that these numbers are actually growing. About a third of the world population have MASLD, and that's really what is driving this disease over the next decades, unless we do something both at the patient level, as patient-centered care, but also at the policy level, where we're addressing not only MASLD, but also diabetes and obesity.
Do you see Brazil and Latin America in this scenario?
Um, it's and unfortunately, it's not good news because Latin America has the highest prevalence of MASLD in the world. And it may be because of a couple of things. I think there is possibility. This is a complex disease, meaning that there is genetic and there is environmental effect. So, on the genetic type, there is a single nucleotide polymorphism called PNPLA3 that is common actually in Brazil, which from what I understand, in Latin America, obviously. But on the environmental side, it's really driven by a few things that just make it simple. By abundance of ultra processed food, which causes basically development of food swamps. And the second, of course, is high sugary beverages and lack of activity. All of these together can drive this. One important issue that we have recently understood is that in a lot of part of the world where alcohol is also available, even moderate amount of alcohol use can worsen this disease. Although this is not alcoholic liver disease, it used to be called non-alcoholic fatty liver disease. It is still, even in moderate amount of alcohol, this disease can actually get more aggravated. So I see the burden of disease being high in this region of the world. It is really driven by both the genetic predisposition, but also environmental factors that we are dealing with, lifestyle of urbanization, which brings in the ultra processed food, but also having alcohol available that can also sort of promote this disease into becoming more and more aggressive in the future. I predict that, and you and our colleagues from Brazil and ourselves have done the 20-year prediction of this disease, and we know that this disease is going to increase substantially in Brazil, not only in terms of number of cases, number of causes of cirrhosis, but also economic impact in this region is going to be substantial. Opportunity to educate our colleagues in the medical field, but also our colleagues and our friends in the policymaker side, so that we can intervene.
What do you think is the biggest challenge in hepatology today and in the near future?
I think the biggest challenge in hepatology, in my view, is that we have shifted away in a lot of the part of the world from really what we used to call just viral hepatitis dominant disease to to steatotic liver disease dominant sort of liver diseases. This means that when you look at MASLD or metabolic associated liver disease, and you combine that with alcohol associated liver disease, you're dealing with the majority of cases of liver disease in the world. How do we actually train our trainees to understand how to deal with this, not just as a hepatologist, but as hepatologists with understanding of metabolic health, so that we improve this. This requires raising awareness at all levels. This requires us to train ourselves in metabolic health and then work together as teams, integrated teams that include hepatologists, primary care physicians, endocrinologists, cardiologists to work together to deliver patient-centered care. We have a great opportunity because with the invention and improvement of AI, we can actually use technology to identify the patients at risk, and increasingly more and more with better drugs, we can and better interventions and lifestyle, we can hopefully improve sort of how to target the treatment and how to develop what's called personalized medicine for individuals. That's coming to the future. And I think this is going to be both our challenge, but also our opportunity.
So, Younossi, thank you so much for your words, for your time. It was fantastic to have you here in this meeting, and I really hope you can come back again in the near future.
Thank you very much. And with friends like yourselves and others in Brazil, I've been delighted to be here, and I'm going to be delighted to come back.
Thank
Thank
you.
you.